I can say that I feel much better than I can remember. There would be days I wake up feeling good. And for the first few times that was happening, it was like, what did I do to feel so happy and energetic? And I've come to realize, well, that's probably how I should have felt most of the time before.
In this episode, we're speaking with Dr. Scott Lear, a professor of health sciences at Simon Fraser University and the Pfizer Heart and Stroke Foundation Chair in Cardiovascular Prevention Research at St. Paul's Hospital. He's also a podcaster and a blogger who knows that if you want to reach people, you cannot do it with medical journals alone. Now, Dr. Lear is not only a health practitioner, he's also a patient. His experience with heart disease and mental illness helps inform how he promotes healthy lifestyles to others. We'll talk about what he does to prioritize his health and what we can all do to prevent heart disease and better manage our mental health. So you're an expert in heart health. You've built a successful career speaking and writing about the heart and cardiology. And then you find out, about 2 decades into said career, that you have issues that you couldn't believe that you actually had?
Yeah. And it's a funny, but personally ironic and sad. I'm sure once I finish, people will be like, either judging or just like, okay, so I'm a human. So it was probably around, trying to think if it was 2016 or early 2017 that I finally went to my cardiology friend who was a former supervisor on my PhD committee. And I'd been getting, maybe for about 10 years, I would, when I'd swim, I'd get a run of really rapid heartbeats, and then it would go away. And I did talk to one of my cardiologist colleagues when I was sitting beside him on an airplane, and he was actually doing a sports cardiology PowerPoint on his computer. And I just mentioned this. He said, if it happens like a few times a year, don't worry about it. So I didn't, but over like that 8 to 10 year period, it started happening more frequently. And it got to the point where it was happening, like I'd swim 4 times a week and it was happening a couple times a week. And it would always be when I was like maybe pushing myself, and when swimming, maybe I was tired. And so that's when it would happen, kind of when I had a bit, maybe adrenaline or anxiety going. And I actually put it off for a bit because I knew as soon as I would tell my cardiology friend, it was a door that I could not close. And so I actually wrote a very long, detailed email to him. And so he got me in, and the shorthand is that I have what's called an exercise-induced arrhythmia. And so when my heart rate gets to a certain level or is excited, it starts beating really fast. And it's beating so fast because our heart is our pump in our body and it moves our blood. So when it relaxes, that's when the blood fills, and then it contracts and the blood pumps forward. If it goes too rapidly, if it's beating too fast, it's not really having a relaxing period. It just barely opens and beats again. So no blood gets in. And so if that happens for a long period of time, you're not getting blood circulating throughout the body, and the person could go into cardiac arrest. And at the same time, I underwent some other tests to look at my arteries in my heart. And I had a CT calcium scan to look at calcium in the artery, which is an indication of if you've got any blockages. And so one of my main arteries had 20% blockage. And at the time I was like, how could I have any blockage? I was expecting 0. And they were saying, oh, this is pretty good. You got 20%. And so at first it was like a shock to me. Yeah.
I want to get to maybe some of the changes you've made since the diagnosis, but I just want to go back to say that a doctor specializes in heart health and disease prevention didn't want to go to his doctor because he knew what he was going to say. You kicked the can down the road like all of us would.
Yeah, yeah. And that's, I've heard so many stories of doctors themselves doing this, like, uh, doctors, like a cardiologist, not uh, heeding the warning signs that he had of heart pain, and then unfortunately had a heart attack a few weeks later. Survived it and was fine. But yeah, that's why they say doctors can be the worst patients.
So, I mean, by the sounds of it, you're a very active lifestyle. I imagine that means you fuel your body, sufficiently. Your nutrition is good. So did you have to make, aside from the beta blocker, did you have to make any lifestyle changes to anything, diet, physical activity? What changes did you have to make?
I remember having this conversation with my cardiologist, and he was like, so there's two things. There's one conversation I had with the cardiologist regarding the blockage in my heart, and he thought my lifestyle was already fine. Like I couldn't really, exercise more or eat better. I think I do. I have made some changes in my diet. I'm more conscious of eating protein from any source as opposed to before. And that's also come from like my own, not necessarily my research, but just my own reading of other people's research that active people, and especially as we get into the 50s, 60s, 70s, 80s, we need more protein than what the general recommendation is. And even people coming into our cardiac rehab program, a lot of the dietitians would talk to a lot of the patients to actually increase their protein. So that's probably one of the things that I've done. I'm, in the last few years, I'm probably a bit more kind of, per se, gentle in my exercise and not going as hard. Still putting in the time, but not necessarily pushing as hard.
I want to get this part right. You led a study on the effect of physical activity on mortality and cardiovascular disease, evaluate 130,000 people between the ages of 35 and 70 across 17 countries over 7 years. Now, I'm sure it revealed a lot of things, but what were the main takeaways?
Yeah. So there are a couple main takeaways. So one of the takeaways is that physical activity, and the more physical activity you do, you have a lower chances of early death and getting heart disease. So that's not really new, but the novelty of that study is of those 17 countries, I think 15 of them were low and middle income countries. So from a kind of a science physical activity point of view, we didn't have much information on, what happens with people who are active in China, India, Bangladesh, different countries in South America to that extent, and other countries around the world. The other thing is that a lot of times the research looks at people who meet the guidelines. So the recommended guidelines are at least between 150 to 300 minutes per week of moderate activity. So moderate activity would be a brisk walk. If you're doing something vigorous, like going for a run, playing tennis, something like that, then that might, you can do less minutes with higher intensity activity. And so usually most studies look at it kind of black and white, and that like you either meeting the guidelines or not meeting the guidelines. What we did is we took those people who were meeting the guidelines and then divided them into two groups. And like if you did more activity, was that better than meeting the guidelines? So we had a group that was not meeting the physical activity guidelines, a group that was in between the guidelines and 5 times the guidelines, and a group that was doing more than 5 times the guidelines of physical activity. And that's actually, we could really only get sizable numbers by including those other countries, because you can only really get those super high levels of activity if you're doing it as part of your daily life, right? Like if you're working at a desk job for 8 hours and go out for a run, which is fantastic, you're still not getting that same amount where you might be getting like 20 to 30 hours physical activity. And we might see that in certain jobs here in Canada, like the letter carriers who are walking around for 6 hours a day. And so what we found is, sure enough, the more activity that people did, the lower their chances of early death and heart disease. And we didn't see any problems with people who are doing even really high amounts of physical activity, which is very reassuring and confirming because there are some studies that question whether you can do too much physical activity.
What about the people that are meeting the guidelines but can't go further for exercise, but want to increase their chances of living longer? What other things can you suggest to help?
So if we think about that person who's 8 hours sitting during the day, you could take two people who have the same job and one person who's maybe sitting continuously for 2 to 3 hours at a time without any breaks. And the other person who maybe every half hour gets up and walks around for 2 minutes, or, if they're so inclined, does some jumping jacks or push-ups beside their desk or squats for a couple of minutes. And these have kind of got the catchy term exercise snacks. But it's just movement. That person, even though they're sitting the same amount throughout the day, that person who's breaking up the sitting is going to have a lower risk for type 2 diabetes, cancer, heart disease, early death. So those are some simple things that are not really exercise based that people can do. Just sticking with physical activity is looking at ways you can weave it into your daily life. And that might be, if you're driving, if you're commuting, if you just park a bit further or take the stairs instead of the elevator, walk up the escalators, anything that's kind of movement can help. Outside of physical activity, I think the number one, if we're looking at nutrition, number one thing people can do is reduce how much highly processed or ultra processed foods that they take in. I'm thinking about foods that might have you have to unwrap 3 different layers before you actually get to the food or something like that. Those things, they're high in sugar, they're high in additives, they're high in things that we're not quite sure what they're doing to our body. And then there is some evidence that some of the packaging seeps into the food in these products as well. So, keeping to a diet, what that has for most food, it looks kind of not too far removed from what it looked like when it was growing. So it's minimally processed.
How closely tied do you think our physical health is with our mental health?
We kind of think of them separately. And I wonder if that's because we like to think that our thoughts are some kind of thing outside of our body and it's something we can't explain. But, the reality, and this may sound very kind of unromantic in the sense, every thought we have is a chemical reaction. Right? It's neurons, there's stuff going on in our brain, molecules interacting, just like molecules interact and regulate our blood pressure. So it's incredibly tied. There's there's evidence of the brain gut pathways that based on what you eat can affect how you think. We know that if we're sleep deprived, that could affect how we think. Hopefully people know that and realize that, when they're active, get out and do something, they feel happier, they're in a better mood. So there's, huge connections there for sure.
And you've had experience with some mental health issues in your day. I think I read that you just completed not too long ago a program to help deal with it. If you could shine some light on that.
Yeah, it was 3 years mid-December. I was diagnosed with depression. And the thing with depression is just like heart disease, type 2 diabetes, cancers, that usually by the time you're diagnosed, you've been dealing with it for years before, right? Without knowing it. And then I went into, I would say like I was in a pretty dark place. I went into a private inpatient facility. We don't have the same healthcare services for mental illness that we provide to people with cancer, to people with heart disease, to people with kidney failure. So I looked at solutions within public healthcare. And when I talked to my family doctor and I talked to a friend of mine who's a clinical psychologist, I saw this inpatient program, and both of them said, you know what, independently, we tell our patients that can afford it, if they can do it, to do it, because then that's going to be the best type of care that they can have. And, I'm privileged. I was able to, get some money out of savings and pay for it. But I'm also like, it saddens me to think that we don't have that access of services. The option that I had for any type of like residential care within the public health system was only if I was a danger to myself or somebody else. And then, the average stay there, the nurse told me, was like 5 to 7 days. So that's, I'd like to see definitely more healthcare resources put towards this for sure.
Do you have a feeling that, again, just going to see the doctor, something would be confirmed that you already knew, or did someone you love say, I think you need to go seek help?
Yeah, it's pretty emotional situation. These things are, these conditions are very damaging to the people around you, and you don't know that. I knew I wasn't happy for a long time, but I didn't know what to do. I didn't know what the answer. I had gone to a counselor, 20 years before, and I had told that counselor I had thoughts of self-harm, and the response I got was, well, that's a bit extreme, don't you think? And that put me off of going to counseling. I thought I felt ashamed, and I kept them inside for so long. And then, I think it was there before, but it's the pandemic when all of us were in the house all together, and, I wasn't doing well. I was fooling myself. I thought, oh, I'm not doing okay, but that's okay. And as long as it's not affecting anybody else. But I was totally oblivious to the fact that it was affecting everybody else. And it came to kind of a big blow up in my family, and that was kind of what led me to like, okay, I've got to get some help.
How are you doing now?
I can say that I feel much better than I can remember. Like there'll be for years, there'll be days I wake up. There'll be days I wake up feeling good, and for the first few weeks or times I was happy, I was like, what did I do to feel so happy and energetic? And I just, have come to realize, well, that's probably how I should have felt most of the time before as well. So I'm in a different place in my life, but I can definitely say mentally, I feel remarkably better.
Why do you think the stigma that surrounds mental health is so much greater than physical health? Why isn't it just not health yet?
Yes. Yeah. Excellent question. I think it's because of a lack of understanding, a lack of true scientific understanding of what's happening. We can see the heart, we can see the kidney, and we have a really good grasp of the biological mechanisms and interactions that are happening. We don't have nearly that understanding in the brain. And and so I think because of that, and we don't have maybe great treatments, that we kind of shy away from that and things we don't understand.
I don't know if this is a rudimentary question, but did you approach trying to get better with your mental health the same way you did after you had your diagnosis with your heart? Did you have to approach it differently?
Yeah, and when you asked earlier about what lifestyle changes I made with after being diagnosed with heart disease, I would say I made far greater lifestyle changes after being diagnosed with depression and going through treatment. I was, I responded very well to the behavioral therapy. I approached it with the scientific curiosity that I've been trained to have over the last few decades in the career I have. I would say like I was a good student. I asked in this treatment program, we didn't have anything formal on the Saturday, Sundays, but I'd always go talk to one of the psychiatric nurses on the weekend or get some specific kind of help for my situation. And and then when I came home, I was still doing it. And so that gave me a bit more comfort in both addressing that in my mindset and the time that I have. And yeah, I kind of approached it as if I was taking a course back in university.
Mm-hmm. What if there's someone that's listening that's kind of at the age where you were when you told your therapist you were thinking of self-harm and they said that's a little extreme? What if there's someone trying to deal with this on their own and they don't kind of know where to start? They know they need to start somewhere, but how can you begin to manage this by yourself or at least start the process of getting the help you need?
Yeah. So the first thing is and it'll sound simple, but I'll explain why it's probably not as simple. The first thing is to talk to somebody, anybody. But we kind of convince ourselves out of it. Like some people might have bad experiences, and that's kind of what I experienced with my counselor. So I was put off of that. But I was also at the same time, then I became familiar with those thoughts that I just thought everybody had these types of thoughts, right? And so I thought, okay, well, this is normal and I can't be any different. And at the other time, and then you get concerned, if you do talk to somebody, are they going to judge you? Are they going to listen? Because the first thing you want is somebody just to listen. And you just kind of talk, they're too busy. I wake up at 1 a.m, I'm having this, I'm all alone. And you just kind of think that you're all alone and it just gets worse and worse. And you could have a partner sleeping in the bed beside you and just feel so alone. But at the end, what I've realized is that anybody in your life that cares about you, family, friends, they would much rather get that call at 1 a.m. than a call, 10 hours later, something worse.
Yeah.
So that's what I tell myself and as well that I find helpful.
Okay. We'll wrap it up here quickly, but for some people that are going to go out online and seek some information of things they're feeling, how do you separate the BS from the real, the misinformation? So how can someone separate the misinformation from the stuff that really matters?
Oh, yeah, that is, it's really, it can be really hard, because even with my background, sometimes, things can sound really true. And, my first thought, what I usually do is I look at multiple different sources to see if there's a common message. And that can work in a lot of cases. Like if let's say you see an Instagram post and you're interested, well, take something of that and then Google it and find something else that that's credible, and see if it's kind of saying the same thing. there are quite a few influencers who spend time debunking them. It's just not easy to find those people compared to the others. A lot of times especially in nutrition, anything that promises results with doing little work is probably not true.
The name of the podcast is called Don't Change Much. And we ask all our guests, what does that phrase mean to you in terms of bettering your physical or mental health?
Yeah. And so the first thing I thought of, like, if I was only making a small change, is making sure you get adequate sleep every night. And because that's kind of the foundation for how the rest of the day is going to go. Yeah. And if you get a good night's sleep, you got energy. Then if you got energy, you feel like being active, you make smarter decisions, you're in a better mood. All of those things do trickle from adequate sleep.
Well, really thank you for your time today. I mean, obviously you come from an educational background on these matters and also an emotional background with yourself. So I think your expertise is invaluable, and we appreciate your knowledge and your story, because I think it's going to really resonate with a lot of people out there.
Oh, well, thanks so much. It's a pleasure to be on the show.
Now, if you'd like to hear more from Dr. Lear, you can read his blog at drscottlear.com or listen to his podcast, How to Health. Links to both are included in this episode description, and you can join us every month on the Don't Change Much podcast by clicking the follow button. We thank you so much for listening.